I call this Onslow County Board of Commissioners meeting to order. We'll open tonight's with Ms. Moxley, a word of prayer, followed by the Pledge of Allegiance. Ms. Moxley.
Let us pray. Almighty and eternal God, thank you for giving us another day. Bless our community and all who are gathered here this evening to observe or participate in tonight's meeting. As we look upon the responsibilities before us, grant us wisdom to make good decisions, strength to do what is right, and compassion for those we meet along the way. Heavenly Father, we ask your blessing upon our commissioners as they face the tasks of this agenda, that no burden be too heavy, no duty too difficult, and no work too wearisome. Grant them insight, inspiration, and industry as they work for the good of our county. God of grace and goodness, thank you for the Girl Scouts who bless our community with gifts of service, making Onslow County a better place for all. We ask for your watchful care over our men and women in uniform, especially those in harm's way and the families they have left behind. Lord, as we celebrate our diverse heritage and culture, help us to remember that we were all created in your image. Now, dear Lord, with deep respect for the faith, traditions, and beliefs of all who are gathered here, hear us in a moment of silence. Thank you. Please join the members of Girl Scout Troop 680 and their leader, Jennifer Mullins, as they lead us in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, girls. That was wonderful. We appreciate you leading us in our pledge. I would like to welcome everyone for joining us tonight. It's always good to have the sheriff in the house. I'm honored that many of our hospital board members are here tonight. Thank y'all for coming, and thanks to all the citizens that have shown up. If you have not silenced your phone, please do so now. The board affords the public two opportunities to speak each meeting, and normally I touch the highlights of the rules of procedure. They are posted in their entirety in the back of the room. These rules of procedure apply only to the public comment sections, the item 3 and item 8. They are not applicable to the entire agenda. Your first opportunity at item 3 is to speak for 3 minutes. You can speak on any item that the board has authority over. Item 8 is public comment, and you can speak on any item that the board has authority over, even though it's not on the agenda item like item 3 must be. During your comments, we ask that you sign up in the back of the room. If you wish, you can read over the rules of procedure in their entirety. These rules of procedure have been adopted by the boards previous to this board and have been in effect for many years. We ask that once you come forward, you address the board in its entirety, that you keep your comments civil, and no endorsement of a candidate or a business. The Board of Commissioners reserve the opportunity to respond to your comments at item 10, which is Commissioners' comments. With that being said, I would ask for a motion to adopt the agenda.
So moved.
I have a motion and a second. Somebody didn't listen. I have a motion and a second. All in favor of adopting the agenda, say aye.
Aye.
Passes unanimously. The consent agenda Can I have a motion to adopt the consent agenda? Second? Second. All in favor of adopting the consent agenda, say aye.
Aye.
Passes unanimously. Item 3 is public comment. Mr. Manager, do we have anyone signed up?
Madam Chair, we have no one signed up for the first public comment period.
Very well. Could you take items 4, 5, and 6, and let's move through the proclamations?
Yes, ma'am. Item 4, presentations. These are proclamations. There are 2 that have been prepared for this evening. The first is Girl Scout Week. State of North Carolina, County of Onslow Proclamation, Girl Scout Week. Whereas March 12, 2016 marks the 104th anniversary of Girl Scouts of the United States of America, founded by Juliette Gordon Low in 1912 in Savannah, Georgia, and whereas throughout its distinguished history, Girl Scouting has inspired millions of girls and women with the highest ideals of courage, confidence, and character, and whereas through the Girl Scout leadership experience, girls develop the skills and lessons that will serve them a lifetime so that they may contribute to their communities. And whereas Girl Scouts have shaped the lives of 53% of female senior executives and business owners, 60% of women in Congress, and virtually every female astronaut. And whereas more than 3.2 million current Girl Scout members nationwide will be celebrating 104 years of this American tradition, with 59 million women who were former Girl Scouts and living proof of the impact of this amazing movement. And whereas Girl Scouts North Carolina Coastal Pines connects over 41 counties together, spanning central and eastern North Carolina, with almost 26,000 girls and over 9,000 adults, including over 800 within Onslow County. Now therefore be it proclaimed, the Onslow County Board of Commissioners commends the dedicated volunteer scout leaders and institutions that assist the Girl Scouts in benefiting youth in our community, and proudly proclaims the week of March 6th through March 12th, 2016 as Girl Scout Week. Representatives of the Girl Scouts, Troop 680, as well as Ms. Jennifer Mullins, their troop leader, are invited to come forward. Chairman Eichner will present the proclamation. And after the presentation, if you will remain there for a moment for photographs.
I'll get down on this side if you don't mind. Thank you. On behalf of the Board of Commissioners, I want to thank all the Girl Scout leaders in our community. I know in today's society where we have so many mothers that are outside the home earning a living, it is important that we still have structures and people that our young ladies can look up to. It was an important factor in my childhood, and I know the benefit of having outside help when you're a working mother to help be there and show a role model for your young girls. We thank you. Thank you so much.
Thank you so much for this proclamation. We accept this on behalf of all Girl Scouts, leaders, and volunteers of Onslow County. And we join everyone to help us celebrate Girl Scout Week, March 6th to the 12th. And it's cookie season.
Thin mints. Thank you. Let's give the Girl
Thank you.
Scouts.
Thank you.
Okay, thank you so much.
Thank you.
Appreciate the work you do.
Oh, thank you.
The second proclamation prepared for this evening is the proclamation regarding Black History Month 2016. At this time, I'll read it into the record. Whereas the history of African Americans is unique and rich, and one that has helped to define what it means to be an American. And whereas each February we pause to reflect on the contributions of the African American community to our national and local identity, and Black History Month gives us an opportunity to learn more about this important part of our nation's story. And whereas we join with all Americans in celebrating our diverse heritage and culture, and continuing our efforts to protect democracy for all people, and recognizing the vital achievements of our local African American residents. And whereas the development of the Jacksonville-Onslow African American Heritage Trail is a combined effort of Onslow County Tourism, the Onslow County Museum, and the Minority Business Services Division of the Jacksonville-Onslow Chamber of Commerce. Now therefore be it proclaimed that the Onslow County Board of Commissioners acknowledges February 2016 as Black History Month in Onslow County. Representatives of the Jacksonville-Onslow Chamber of Commerce Minority Business Services Committee are invited forward at this time to accept the proclamation. Chairman Eichner requests that the entire Board of Commissioners present the proclamation.
I believe at this time I'll ask my board to come forward and make the comments for tonight. I know that they feel as deeply about this award as I do. So, Paul?
This means a lot to me, and Millionaire, I need to thank Millionaire. You've kept me in the loop of this. It's invited me many, many times to a lot of the conferences and workshops, and I have been around that, and you've been very instrumental in a lot of this. So I want to thank you for that, and from the bottom of my heart and all the commissioners, this is a great thing.
W.C. Jack.
I don't know if you want to give me the mic because,
Take it away.
oh, okay. Let's get back on track here. I would say that this is an honor on both sides for me because many of you may not know, but that's where I got my start here in Jacksonville, was at the Jacksonville-Onslow Chamber of Commerce. And as soon as I started, the week that I started, the African American Heritage Trail was my first project that I had the opportunity to take hold of. And to see the growth that has taken place and to see the number of the sites that are here in Onslow County and the history, I've learned so much through that trail. And a lot of the citizens have learned so much. And now to be part of this great community as a county commissioner, that we stand behind all of this that happens here in this county, I'm honored to be here. And Lorette, you and your people, take it away. Love you guys, and God bless this trail. And thank you all for what you all continue to do. Thank you.
W.C.
I don't know a whole lot I can add, except, as Paul said to start with, about the loop that they have kept us in. And it has been a pleasure to be participating with one time at one of your weeks that we had back here 2 or 3 years ago. I remember they wanted the Georgetown School was a black school at one time, the only one in Onslow County High School. And they were scared they wasn't going to have the opportunity to go in that school or have anything to do with that school. But I want to say it was a pleasure for the board, Owasso board, to make arrangements that you people could have a room and celebrate your heritage right there in that school. It was a great pleasure, and I'm willing to help anytime I can.
Jack.
It's a pleasure for our board to recognize the community of small business and African American. Any small business is good for Onslow County, and what the small businesses do, whether it's African American or any other small businesses, the driver of the train that drives our economy. Small businesses really put us on the map. If it wasn't for small businesses, we wouldn't thrive as the way we do now. So congratulations on your achievements with the Small Business Association. Thank you to Chamber for putting this together and allowing them to have an opportunity to be a part of this. And I'm proud to be a part of offering and part of the proclamation. Thank you so much, and thank you folks for coming tonight to see this event.
Presenting to you. Okay, girl. I'm not going to make any comment. The microphone belongs to you. You say whatever you like.
Well, we thank you. That's my first but we thank you for we always have your support.
Thank you.
Every time we get ready to do something, the commissioners are always there to give us backing. There's no way the African American Heritage Trail would be what it is without all of the entities being involved. There are 12 sites in Phase 1 that are all completed. You can stop by the chamber, pick up a map there, go by and visit those sites and learn of the rich culture the African Americans have in Onslow County. This is such a unique place. And I just ask that you go by and get that and go and take a visit and see what we have done thus far. I accept this on behalf of the committee. We all work hard to do what we do, as well as the chamber. Lorette, she allows us to do these things, and so we appreciate it greatly. So I'll just say thank you very much, and we humbly receive this.
Let's give them a big appreciate you coming.
Yes, ma'am. Oh, okay.
Item B is the Onslow County Hospital Authority Annual Audit. The Onslow County Hospital Authority has requested permission to present the board with its financial position as of fiscal year ending September 30, 2015. Mr. Richard Bavard of Deloitte & Touche will be presenting the audit. Mr. Bavard, the podium is yours.
Good evening. We have completed our annual audit of the 2015 financial statements for the Onslow County Hospital Authority, and there were two documents that I believe you were provided with in advance of this meeting. The first I'll comment on is with the bright blue cover. This is the actual audit report. It's about a 50-page document. I'm not going to take you through the entire document, just going to make reference that basically what it includes is really it's a combined report. One, there's an opinion in the first couple pages that is the opinion on the financial statements, basically the balance sheet and income statement and statement of cash flows, if you will, of the report. And then also in the back, there's a compliance section that is required. The hospital authority has a mortgage debt that's insured by the FHA or HUD. And based on that federal insurance, they're required to submit to a annual compliance audit. So there's actually two reports on compliance as well as controls over compliance. I'm glad to report that all of the opinions within this report are unqualified. That's the best report you can receive as a result of an audit, and there were no compliance exceptions identified during the audit. The other document that you were provided with is a little more detailed document. It has the more white cover. And this is referred to as a required communications document. Under our professional standards, there's a sort of a laundry list of requirements. Anytime we meet with a governing body to review the results of an audit, there are various items we're required to go over. I do want to comment that we actually have been through this document twice before, once with the Finance Committee of the authority, and that was about a 45-minute to an hour meeting in which we went in a great deal of detail over the results of the audit, a lot of Q&A, back and forth discussions about the results of the audit. And then after that, we actually met with the full board of directors of the authority, and that was about a 15 or 20-minute presentation, also going into a little bit less detail, but still a fair amount of detail over the results of the audit. I'm not going to take you through all the pages of this document. Just would point out a couple things. On page 2, which is the client service team, you can see that there's a wide variety of specialists that are involved in the audit of a complex organization like the Onslow Hospital Authority. Then pages 5 and 6 is really the list of the 10 or 12 required communications that auditors are to provide as a result of an audit. Really just hitting on a couple of those key items. There were no disagreements during the audit, no particular difficulties, no material weaknesses were identified related to controls. There were no audit adjustments that were required to be recorded. Again, all very favorable, positive results of the audit. Pages 7 and 8 provide a little more discussion about some of the key areas of management judgments and estimates. There are certain elements within financial statements that involve some subjective judgments that are made by management. We focus on those a little more closely than we do other areas of the audit. There are no significant issues or difficulties noted in those areas as well. There were no changes in accounting policies this year that were elected by the authority. Really, the only key change is there was some new accounting guidance from the Government Accounting Standards Board around accounting for pension accounting, so we worked with management in that reporting around their pension plan. With that, I would be glad to respond to any questions or comments you may have, but that really completes the presentation I wanted to make regarding the results of the audit.
I'm just going to open it up for discussion to the board, if anyone has a question. I will ask a couple questions because I know our listening audience has heard and read a lot in the newspaper about the stability of our hospital. And our hospital is a gem to Onslow County citizens. So financially, can you just tell our citizens the financial status that we're in? And are we seeing improvement in the amount of loss in revenue that we routinely have every year?
Just to make a few comments, one from a balance sheet or financial position standpoint. The current assets exceeded the current liabilities of the authority this past year. So there was net working capital of about $5 million. It's preferable to be in a positive working capital position. The total net position or equity of the authority, which is total assets over liabilities, both current and non-current, is about $75 million, and that improved by about $5 or $6 million this past year. Total revenues actually increased about 3% year over year. There were some expense containment actions that the authority took this past year, so there's actually an improvement in the operating income. Actually, the authority has generated operating income the past 2 years. And the other thing that folks typically would look at when evaluating financial stability is cash flows from operations, and the cash flows from operations increased from $11 million positive last year to $25 million positive this year. So from both the balance sheet, income statement, and cash flows, all three of those statements indicate some positive movement this year in overall financial condition.
That's absolutely wonderful.
I just have one, maybe you can answer it, but I spoke to Dr. Piper briefly before the meeting, and the Blue Cross and Blue Shield with a recent move to pull out from Onslow Memorial, the lower insurance, and then Carteret County also had Blue Cross pull out. It seems like every time we get to a point that we making progress and getting in the black and getting on our feet, it seems like something comes along that changes that around and tries to drag our community hospitals back under. What are you seeing with the trends from, I know you do audits from other hospitals and other community hospitals. Are you seeing that trend everywhere, or is it just something that's in regional here, or what's your observation of that, sir?
No, it's certainly, it's really nationwide. This is a time of a lot of change in the area of healthcare, both with the Affordable Care Act and other developments in Medicare, Medicaid, as well as third-party insurance companies. It's a challenging time. It's an industry that is dealing with more change than probably most other industries are dealing with. Part of what we do in our audit process involves some Medicare, Medicaid, and third-party reimbursement specialists to assist us in the audit process. But it's certainly a challenging environment.
Thank you, sir.
Yeah. Madam Chair, and certainly that was a question that I was looking to have answered, the estimated third-party biller, because I know you look forward to trying to get that payment from those third-party settlements, and how do we compare with other community hospitals as far as getting that money through third-payer parties?
I would say you're generally consistent with what we see with other hospitals, both of this size and larger. It's certainly an area of focus, but we kind of view you as in line with what we see in the industry.
Well, I guess it's good to be in line with the industry and not that we're way behind in that factor, that, we're having such a difficult time getting, the hospital paid from those other sources. So thank you for that.
If there's nothing further, the board will just say kudos to the Hospital Authority Board. Keep up the good work, and thank you for this nice audit.
No, thank you very much.
Item C is the Onslow County audit for fiscal year 2015. The annual audit for the fiscal year ended June 30, 2015 has been completed. Mr. Dean Horn of the independent accounting firm of Carr, Riggs, and Ingram, LLC, will be in attendance to make a presentation to the Board of Commissioners regarding the annual audit for the county. Mr. Horn.
Good evening. The audit report for the county this year is a little over 200 pages. For the sake of time and everyone in the audience, we won't go through all 200 pages. We will hit a few high points. As was previously mentioned in the prior, there's several auditors' reports within the bound copy of what you have there. There's an auditor's report on the basic financial statements, which is in the front half of the report. The last section of the report has 3 additional auditors' reports as it relates to expenditures of federal and state dollars because of the significant amount of federal and state funds that run through the county. We're required as auditors, based on certain thresholds, to look at how those dollars are spent. The highest level of opinion the auditor can give is an unqualified opinion, and so I am pleased to say all 4 of those opinions for the county for this fiscal year were unqualified opinions, which is what you strive to have when you have an audit. There's a lot of financial data within the report. Typically, a government, there's one thing that most governments are interested in is what is my fund balance available as far as to meet obligations going forward, and how does that stack up as far as what published benchmarks are. We've talked in the past that one of the benchmarks the State Treasurer's Office looks at is a benchmark of 8% of budgeted expenditures is the level at which they want to see it above. For the fiscal year ended, our unassigned fund balance was about 15% of budgeted expenditures, so we're about twice what that benchmark is. So overall, the county as a whole was in sound financial position. Unassigned fund balance is at a level that would continue to meet provide the services that most of the citizens are receiving throughout the county. So overall, I think it was a very good fiscal year financial operation results, and we continue to be at a stable level going forward. Like I said, there's a lot of data in here, and I'll instead of flipping pages, we'll just see if anyone has any particular questions about any of it.
I'll open it up for discussion from the board.
Sounds like a very good report.
I would like for you to explain the committed and uncommitted, or assigned, I believe was the word that you used, in our fund balance. There are revenue streams in our fund balance that are allocated for specific projects or occurrences. In your auditing, when you talk about our fund balance being at 15%, are you equating in the assigned fund balances or just the unassigned?
Typically, when you look at expenditures, you look at the unassigned. Unassigned, in this particular case, assigned and unassigned are what you would combine to say, here's what's available going forward. The assigned represents, funds that may have been set aside going forward for budgetary purposes going into the current year. But there's basically, 5 categories. There's non-spendable, which is basically inventory, things that you have assets at the end of the year, but it's not things you can liquidate to meet obligations. There's a section on restricted, which is various grant monies may have come in late in the year, so we may not have spent all those funds at the end of the year. State statutes put certain restrictions on amounts of fund balance. So those restricted fund balance are amounts, here again, that are set aside, either statutory requirements, grant requirements. They're obligated for specific purposes, so they're not readily available to meet obligations. Committed is a category of fund balance that the board, because of things that they see the need to provide throughout the county, have committed certain amounts of fund balance for those specific areas. Again, those items aren't readily available to meet general obligations. So the two components, assigned and unassigned, is what's there to meet ongoing obligations year to year on a basis going forward. And so those two combined were the 15% that we were looking at as far as what's available to meet those obligations. But you're very right. There's a lot of components of fund balance that are severely restricted for what they can be used on, and they're not readily available to meet current obligations. That's why we focus on the most finite and tight area as far as what is available.
Well, I know as Board of Commissioners, we are constantly focused on the fund balance staying above the minimum of the state, because we all are aware if our fund balance were to drop dangerously low, the state would step in and say, go sit down, I'll put your tax rate at what I want it at. So we try very hard to maintain our fund balance at a rate that we can allocate funds for specific unknowns that may come towards us. The fact that Standard & Poor's has rated Onslow County with a AA rating, is that something that is unique, or is that something that we have worked very hard for and should appreciate it?
Well, I think you should appreciate it, and it all comes back, to the people here every day. North Carolina is unique in that the North Carolina State Treasurer's Office is very active in local governments and in terms of trying to help keep the state bond rating up as well as the local governments. So they've established these guidelines, and then you guys have done a great job following those guidelines to be able to put the county in position to have those good bond ratings, particularly when you have to go out and save an interest percentage point here and there. It makes a big difference.
It does. It does. So I'm just going to put you on the spot. Onslow County is financially sound in your opinion?
Absolutely.
Thank you. Any further questions from board members?
Madam Chair, I have one. And hearing that, that's a great rating that I know that we have, is a AA. How do we compare in other counties, the other 99 counties that are here in North Carolina?
I don't do, the state publishes comparisons, and the one thing you have to be careful when you're looking at those comparisons is demographics, the area of the state. You wouldn't want to compare Onslow with Mecklenburg. The demographics are different. So, the state, what the state tries to do, and it's available on their website, is based on population size primarily, they group things. And I think if you would go look at the group that you fall in, you would see that year to year you compare very favorably with the others in that peer group.
Well, we appreciate your compliments. This board and our staff, I must compliment our staff, are very diligent and conservative with our financing, and we appreciate you recognizing that.
And they do a great job getting ready for us. some of you guys may know, when auditors come in, it's not always a pleasant experience. And so,
Well, we appreciate it. Thank you so much for your report.
thank you.
Item D is a Health Department presentation. Ms. Angela Lee, Health Director, will provide an update on measures being taken by the Health Department for the Zika virus.
Good evening, Vice Chair, Chairman, and Commissioners. Our Health Department is closely monitoring the Zika epidemic in Central and South America. Importantly, 2 other mosquito-borne viruses, dengue fever and chikungunya, are also circulating in the same region, with symptoms that overlap those of Zika and are usually more severe. Zika is a mosquito-borne flavivirus that in most cases causes little to no symptoms in an infected person. And one in 4 infected people may present with a mild illness or fever, joint pain, and occasionally a rash. Although many people infected with Zika do not even know that they have it, the association of Zika with microcephaly presents unique public health concerns. Microcephaly is a medical condition in which the head is smaller than normal because the brain has not developed properly or has stopped growing. Many viral infections during pregnancy, such as rubella, cytomegalovirus, and herpes simplex, can cause microcephaly. In general, microcephaly is extremely rare because typically the fetus will divert all possible resources to the head to make sure it is the last thing that loses growth potential. But sadly, children with microcephaly often have mental retardation, delayed development, seizures, and other brain or neurological abnormalities. The Zika virus has been associated with microcephaly and other brain and neurological abnormalities. But a definite cause-effect relationship has not yet been confirmed, and conclusive evidence will likely require 6 to 9 more months of careful epidemiological study. In Brazil, more than 4,000 microcephaly cases, a large increase over the normal incidence, were reported between October of 2015 and January of 2016, mostly in areas which coincide with large Zika outbreaks. To date, only travel-associated cases of Zika have been identified in the United States. No cases have been reported in North Carolina, and it is unlikely that Zika will make huge inroads in the United States because most of our country has severe enough winters to cause the mosquitoes to go dormant, and because our country has the resources to do mosquito control, a capability that some other countries in Central and South America don't have. However, due to the fact that Onslow County has the highest birth rate in the state, we have a very large vulnerable population to any possible Zika exposures. Additionally, the silent circulation of the virus in asymptomatic people makes it hard for our surveillance systems to pick up on the disease, which is why we need our providers to be especially vigilant. Therefore, our communicable disease staff has taken a very proactive stance in regards to the outbreak, including taking the following initiatives. We've pushed out guidance to our area physicians, hospitals, and clinics to increase their awareness of Zika. We've participated in live webinars to discuss the Zika virus and North Carolina Public Health's response plan. We posted information on our website recommending that pregnant women and women trying to become pregnant consider postponing travel to areas where Zika virus transmission is ongoing, re-emphasizing the importance of obtaining a recent travel history from any patient who's seeking medical care. We've educated our OB providers regarding the recommendation for ultrasound evaluation of pregnant women reporting travel at any time during their pregnancy to an area with ongoing transmission in order to detect fetal microcephaly or intracranial calcifications. Providing information on specimen collection, testing, and shipment procedures through the North Carolina State Lab of Public Health to confirm Zika diagnosis in patients with a positive travel history to an area with ongoing transmission. And our health department staff visited the offices of our county's 2 largest OB physicians, their practices, on Thursday, February 4th, to personally review guidance on Zika. with specific emphasis on the management of pregnant women potentially exposed to Zika. And Health Department staff are fielding multiple phone calls from county residents who've traveled to Zika-affected areas and from medical providers with questions about testing and medical management of travelers. Our last conference call with the state was on February 10, 2016. The stats that they provided us were we currently, at that time, had 48 cases of Zika confirmed in the United States. In 12 states, Puerto Rico, the U.S. Virgin Islands, and the District of Columbia, with many other lab tests pending. All United States cases except for one have been associated with travel, with one case domestically acquired Zika in Texas through sexual transmission. We have one case of Zika that was associated with microcephaly and 2 cases of developmental abnormalities that have been reported in the United States. We again have no confirmed cases in North Carolina, but we do have many tests pending. I'd be glad to answer any questions that you might have, but I'd also like to share the podium with our Environmental Services Director, Tony Padgett, so that he can provide an update on what Onslow County is doing in response to this as well.
I'd like to just say, as Tony's coming to the podium, that Onslow County only has one health department and one vector control, and we are proactive. We will, regardless of what the disease may be, we will be ahead of it. And Angela, I want to thank you for taking such an interest to make sure that if this does turn into something more significant, you're ahead of it. So, Tony, what are you doing as far as mosquito control?
Okay, we have two mosquitoes here that we have a problem. The Aegypti, Aedes aegypti, which is very rare in our region, but Aedes aegypti is the Asian tiger, which is a carrier, and we have them heavy here. But the good thing is they are daytime feeders. I mean, they're not nighttime biters, they're daytime, and we raise them ourselves around our homes. They're container breeders. Both of these Aedes are. And we are constantly telling people, tip and toss. Make sure your fire pots are dry. Make sure your dog waters is changed often. Make sure that if you have a kiddie pool out there, you don't let it stay and just, get contaminated where we have a host to raise these mosquitoes. And we're constantly doing that. And with the partnership with the health department, we stay in close contact and making sure that the public is looked after. And this Board of Commissioners needs to be very commended for being proactive. I'm telling you, there's a lot of counties does not have a vector program at all. And Onslow County is very fortunate, and we're continued. Just like Chickaganda last year, we stayed on top of it constantly, did we not? And we were very successful because my team is ready to spray. We're ready to do barrier sprays, which can be handled very good as far as around homes and making sure that this does not go any further. We're continuously doing surveillance throughout Onslow County. A lot of people don't know that we have places throughout Onslow County. We set light traps. We're constantly catching them. We're IDing them. If we have a problem, we send it to the state. They confirm what we say, and then we know to double our spraying up or be more constant in that area. So we're ready, and this board needs to be commended as not only in here, y'all are constantly being proactive throughout, looking out for the citizens of Onslow County. And I'm telling you, it's very, very good to have you to be able to do that.
Thank you, Tony. Right now, the weather is a little cold, and we've had a lot of rain. Are you able to get out? Is it beneficial to be spraying now?
No, we do not spray it. Right now, with the weather as cold as it is, less than 50 degrees, they're going to go dormant.
Okay.
They're not going to die. A lot of people think that they freeze and die. They don't. When that water thaws back up and it turns real hot, that larvae will go active and it will hatch. But the main thing is for us in this and Chickaganda is to make sure you tip and toss. Make sure you don't have water. And if you feel like that you've got a major problem, we will put a surveillance there. We will put a light trap there when it gets time. Right now, it's too cold. It's not going to be a problem at this time, but in the future it is. And the good thing is the Egypti is not here, and the host is going to be someone traveling, just like Chickaganda was. I mean, someone's going to have to bring it in, that mosquito's going to bite, and then that's how it's going to transfer. So we're staying in close contact with our health department, as I said, and we're constantly, if something was to happen, of course, y'all would know, staff would know immediately.
Well, I know a lot of people, myself included, have a ditch behind. I can't tip and toss it.
No.
So, you know, I've got to rely on the
Dip and
county.
pitch it.
And then, and most of the time, you will have a different type mosquito there than the Asian tiger.
Okay.
And that will, what we call a tinky-rinky, which is a swampland mosquito, but we will treat that. We have the capabilities to treat that, to make sure that larvae don't hatch, which can bring the numbers down. And that's what we look for in surveillance. If we get high numbers, we treat that area, we won't see them numbers start coming down. Can we kill them all? No. I can tell you that right now, but we can control them, and that's what we're after, is to make sure that we control them in a manner that people can live a good life.
Thank you, Tony.
Tony, how many calls would you say did you get a year to go check or to spray and so forth?
Last year, we had 796 calls in Onslow County. As you know, we do partner with Jones County, and in Jones County, we had a little over 160 over there. So that's in just spray calls. We had right at 900 actual investigations. Some warranty spray and some don't, because we got a threshold of how many mosquitoes, and it's got to be at least 6 mosquitoes a minute landing on you to warranty a spray. And the Division of Water Quality demands us to do those checks.
I got one question.
Jack, go ahead.
Ms. Lee, from what I understand from your report, that the folks that's at most risk are expectant mothers. And what percent of expectant mothers, say they were to, Tony, contract the virus, what, is there a turnaround or is there a cure for the infant child? Or?
Well, again, we continue to do studies, but there's no cure for microcephaly. Again, how the child will be impacted, there are varying degrees of microcephaly, but all the physicians have been given an algorithm to follow in regards to testing. So even some pregnant women who are coming back who are, again, asymptomatic, they can continue to come into their doctors and receive ultrasounds and so forth, so that they can be kind of even just take precautions.
If the mother were to get bitten by the mosquito carrying the virus, does that mean automatically that her child would contract the disease, or it's just, what percentage is that?
I don't have that information. I can try to get that for you, but I don't have that information.
I guess we're still in the
We are.
learning stages and
We very much
exploratory cures and stuff. Thank you.
Angela, both you and Tony, I want to thank you and your staff for the hard work that you do.
Thank you.
One more question. One more thing. Your Vicar control, for the public, what you said you had totaled it up 900,000 calls a year. But I would like to also tell what else you do rather than just Vicar, just mosquitoes.
We also do beaver management, and right now, this time of year, it's busy. I mean, real busy. And we are in partnership with the USDA in that program. So there's a lot that we have going on, and people understand that 1,000 of calls that I'm talking about comes from the middle of April to normally to the middle of October. So it's nonstop. I mean, we have had as high as 25, 28 calls a day. And y'all have been gracious in getting us some new equipment this year that's going to cut our time down on that we can make things better, quicker. And so it's good to have a program, because I'm telling you, when you go to the association meeting, there's a lot of counties that don't have the program, and they're suffering right now. Terrible.
Tony, explain, because I know we talk about the beavers and the beaver problem, because we're dealing with one in Swansboro right now that you're working on, because I had talked to you the other day about that. But the problem with the beavers is it's causing flooding.
Yes.
Would you explain what's going on there?
Yeah, what happens is beavers are, they like to eat trees, and they like to throw trees, and they're very active and vicious in doing that. They want to stop water up. Well, stopping the water up causes the mosquito problem worse, because it floods everywhere. And we're constantly having to go, and people think, well, you trap them 1 year, and that's what the USDA does for us, that you got it solved. You don't. It takes about 3 years to get it under control. We're constantly tearing dams out until we can get them here to help us with the trapping side of it, so the water can get out, because it's causing a lot of flooding in Onslow County. Right now, we're setting, and I'm supposed to meet with USDA man Wednesday morning, and right now I have got 19 different sites for him to go to in Onslow County. And it's busy. I mean, it's busy. And with all the rain we've had, it's made it even worse. So,
And how many do you have on your staff?
4.
So all of that with 4 personnel.
Yes, ma'am.
Thank you, Tony.
Thank you.
Thank you, Angela. We appreciate your report.
Thank you.
Stay on top of Zika. I'm sure you will.
Item 5, general item. The first is a sewer service agreement. Onslow County government operates the Onslow County landfill located on Meadowview Road in the southwest area of Onslow County. The landfill is a Subtitle D lined landfill, which is carefully regulated to prevent environmental pollution. Liquid generated from landfill activities is commonly referred to as leachate, and it is pumped from the landfill into a sanitary sewer system. For the past several years, the city of Jacksonville has treated the leachate under their current out-of-city rate structure. The Onslow Water and Sewer Authority is assuming possession of the sewer main along Pony Farm Road, as well as all current customer accounts along that existing sewer main. As the new provider of sewer treatment services for the landfill, ONWASA's agreement to treat landfill leachate will replace the current agreement the county has with the city of Jacksonville. The agreement has been reviewed and approved by both ONWASA's attorney and the county attorney. The new agreement is similar in many regards to the old agreement. The agreement recognizes that should it be necessary in the future, Onslow County would install such pre-treatment facilities as are necessary to conform to ONWASA's utility ordinance. I might note, as a side note, there are no current pretreatment facilities out there. We don't have to pretreat currently. The Onslow County Solid Waste Fund would be responsible for all costs associated with pretreatment should it ever become necessary. ONWASA is charging the county its standard sewer rate and anticipates a monthly daily average of 35,000 gallons per day, or a maximum of 54,000 gallons per day. The item before the board this evening is to respectfully request that the Board of Commissioners approve a sewer service agreement and authorize the chairman to sign on behalf of the county.
So move.
Second.
Any discussion? All in favor say aye.
Aye.
Passes unanimously.
Item 6, appointments. Consolidated Human Services Advisory Committee. On June 10, 2013, the Board of County Commissioners adopted Resolution 13-010 in order to consolidate the provision of social services and health department functions under county government pursuant to Session Law 2012-126, House Bill 438. In accordance with the requirements of House Bill 438, Resolution 13-10 also provided for the creation of a Health Advisory Committee, membership of which was consistent with North Carolina General Statute 138-35. Dr. Tina Siegel, optometrist category, Dr. Connie Bruce Gilliam, dentist category, and Mr. Michael Richards, general public categories terms expired on November 18, 2015. All have expressed an interest in continuing their service on this committee, and they have provided citizen participation applications. Additionally, staff has received an application from Mr. Tyrone Maxwell for the general public category. All applications are on file and have been certified by the clerk's office. Commissioners, this evening you actually have two separate motions that you would need to take if you so desire. The first is that there are two categorical positions. The first is for an optometrist and the second for the dentist. And the first thing would be whether or not the board wished to appoint those two individuals for the two optometrist and dentist categories with terms expiring November 18th, 2018.
So moved.
Can I have a motion for those two categories? A second?
Mm-hmm.
All in favor, say aye.
Aye.
Aye. Okay. We'll do the ballot for the next category.
Yes, ma'am. The next one is the only category that had two individuals that were interested in serving for the one seat, Mr. Michael Richards and Mr. Tyrone Maxwell. For the convenience of the commissioners, ballots have been given to you, and I'll collect them at this time.
Public comment.
Okay. For the benefit of the public and those watching by television, ballots are provided to the county commissioners when they have different appointments or different individuals that are vying for the same seat. It's for the benefit of the commissioners and is a method approved by North Carolina General Statute. All ballots are available for inspection immediately following the meeting by seeing the clerk to the board, Ms. Julie Wand. All ballots must be signed by the commissioner that's casting the ballot vote. This evening, Mr. Michael Richards has been selected by the Board of County Commissioners to serve the general public category with a term which expires November 18th, 2018.
Thank you, Mr. Manager. At this time, there was nothing pulled for item 7 off of the consent agenda. Do we have anyone signed up on item 8 for the second public comment?
Madam Chair, we do. This is the second public comment period. During this second public comment period, there is a 5-minute time limit. In accordance with the board's rules of procedure, commissioners shall reserve responses, if any, for the commissioner comment period at the end of the agenda. Citizens shall have the opportunity to talk about any issue upon which the Board of County Commissioners have control. Mr. Kevin O'Connor of 210 Newport Drive, Jacksonville, has signed up to speak. Mr. O'Connor, you have the podium for a time period not to exceed 5 minutes.
Good evening, Commissioners. Kevin O'Connor, 210 Newport Drive. I'm here again to address the sales tax distribution. And just so I can show you, I did crunch some numbers. Current sales tax distribution under the ad valorem, there's $400,000 going down to Surf City for 293 residents for a little over just under $1,350 per resident. North Topsail Beach is getting $1 million of sales tax revenue, and per resident, that's $1,372. Jacksonville, under the current ad valorem method, is receiving a whopping $133, and they're dead last as far as all the entities are concerned. Onslow County is receiving $175. The difference for Onslow County under the current ad valorem, I'm going to call it $176, and you were to go to the 60-40 split, it's only a difference of $7, $169. Now, if the county were to go to per capita, every single person receives $170. I live in Jacksonville, I get $170. Commissioner Bright is in the county, Ms. Eichner's in the county, $170. Swansboro, $170. Richland's $170. So it still goes back to the original question of why did the county switch to the ad valorem the year before the reevaluation? And it's ironic that tonight's meeting, that they were talking about fund balance, which I happened to address it at the previous meeting. At this particular point, if you go back and look at the history of this, it was for 15, 16 years that it was per capita. And what happened is the city of Jacksonville was cutting a check back to the county. In 1993, it was written into the agreement that the county commissioners would give all the entities a one-year notification if they were going to change the sales tax distribution. And that was addressed in depth in 2006 and again in 2007. Then it was switched to one-year ad valorem. And then what happened is a whole bunch of people wound up going to work and saying, you know what, I don't necessarily think per capita is right, and I don't necessarily think ad valorem is right when you're looking at the numbers of in excess of $1,300 going down to North Topsail Beach, which I've addressed on numerous occasions, in which North Topsail Beach, as well as Surf City, doesn't need the money. They're rental properties. We had this discussion. 84% of the homes are second homes, and they're for-profit businesses. A lot of them are cash businesses. It's before you go into the full-time residents that rent their houses out for a couple months a year in order to get their mortgages paid for. And again, it's a cash business. So why is that money going down to those entities when the city of Jacksonville is receiving $133, and that's the economic engine of the county? Now, the transmission and the drivetrain is definitely the base, and there's some discussion as far as whether or not those 40,000 or 50,000 Marines that are on base should or should not be included in those numbers. And there's some people that think the city of Jacksonville shouldn't include them. Well, if the city of Jacksonville can't include them, why should the county be able to include them? And then you start going into a whole bunch of federal funding and a whole bunch of other stuff that we don't want to get into. The bottom line is that 60-40 is the way to go. I don't see why it's so hard to change it. You changed it for $1.2 million because of the fund balance. If you had just come back and said, hey, you know what? We did a really good job of maintaining our budget, which we just had the meeting. Fantastic job of running the budget. You know what? We wound up eating the savings account up. And you know what? Before the state comes in and takes over our budget, we need to raise it up 1 cent or 1.5 cents or whatever the penny is. I could have handled that. But instead what you did is you switch it to the ad valorem, which caused the city of Jacksonville 5 cents for every single one of the people that are in there. Those are the numbers. It's a mathematical formula. The mathematical formula doesn't change. And then additionally, when you're going back on this, ironically, is in 07, one of the board members actually originally wanted per capita method of sales tax distribution back in April 07. But for some odd reason, that changed a little over 3 years ago. So 60-40, it's not hard. That's the way it should be, and there was a lot of people that put a lot of work into that. Thank you very much, and by the way, Girl Scouts are great. I have a life member, Gold Award recipient and silver, and I also have an Eagle Scout. Scouts are absolutely fantastic. And good job on 2nd Marine Division.
Thank you. Mr. Manager, do we have anyone else signed up?
No, ma'am, that was the only individual signed up for the second public comment period.
Okay. Would you like to have some comments tonight, Mr. Manager?
Thank you, Madam Chair.
And I must admit to the audience, I skipped over our manager at the last meeting, and he's not let me live it down yet. So take it away, Mr. Manager.
Thank you, Madam Chair. I appreciate that. I would just like to note a couple of important things. First of all, and perhaps the most solemn thing I would like to note is that former County Commissioner Mr. Cecil Morton passed this month, February, and we would like to extend the condolences of the staff of Onslow County to his family. No county commissioner, regardless of what term of office you sit in, has easy decisions before you. I don't know what transpired when Cecil Morton sat in the seats you're occupying now. That was before I was paying attention to local government. But I will tell you that whatever it was, he was an Onslow County Commissioner, and he had to make tough decisions. And so I think it's appropriate that we remember the passing of Mr. Cecil Morton, a past Onslow County Commissioner. Next, I would like to thank our finance staff. Mr. David McCall, our finance officer, is in the audience. Say hi, Dave. No one likes to see auditors come in, even though we know it's a part of our daily lives, and even though Mr. McCall used to be one. But I would like to thank the finance office for doing a good job in making all of the records of county government available. The auditors are here, and in local government in North Carolina, we have a great auditing system and a great institution called the Local Government Commission that really holds cities and counties to the line when it comes to our finances. And we're very pleased with that. That's how we have good bond ratings. That's how the state of North Carolina has a tremendous bond rating. So congratulations to you and your staff, David. I would also like to say thank you to the Veteran Service Office. Now, this is something that has not, I don't believe, gotten a lot of media attention, but it really should. In this report, this is a 2015 North Carolina Veterans Annual Report. I'd like to just highlight something. In the middle of this report, and if anyone in the audience or commissioners, I don't believe you got a copy of this yet, but we're making photocopies for you in our office. But if anyone in the audience wants to see a copy of this is tremendous. Miss Amelia Grissett with Onslow County Veteran Services has really led the state of North Carolina. And there's this comparison of all 100 North Carolina counties. And so let me just read a couple of numbers. This is really good stuff. Onslow County has a veteran population of $29,203. Okay, remember that. Onslow County has a veteran population of $29,203. Through the efforts of our Veteran Services Office, which is part of Consolidated Human Services, led by Assistant County Manager Sherry Slater, we were able to gain in compensation and pension benefits for our veterans $233,562. That was for year 2015. Now, that by itself, if you stop there, that's part of the story. And that's not enough. Let's just have a comparison county. What's a big one? How about Mecklenburg? That's a really good one. Earlier, we had our own auditor said you should never compare yourself to Mecklenburg. Let's compare ourselves to Mecklenburg. Remember, we have a veteran population of 29,203. Mecklenburg County has a veteran population of 57,094. That's almost twice the veteran population, right? Their compensation and pension gained was $173,057. Remember, ours was $233,562. For roughly half the veteran population, we got $233 versus their $173. And if you look on farther, Wake County, 59,000 veteran population. Remember, we're 29,000. Wake County, 185,000 gained. We're at 233 gained. So now we are lower than, say, Cumberland County. I looked at Cumberland County because I was on a roll. The first one I looked at was Mecklenburg and then Wake County, and I thought, man, if we can get Cumberland. But they have a much, much greater veteran population, and they also do have greater compensation and benefits. But this is just a testament that Amelia and her staff, with a fairly small staff, have done great things. We have a veteran population that is growing, expanding, because more veterans, I believe, are finding that it's great to live in Onslow County, even after you retire. And so this is really good news. The other thing that I would like to do is I would like to give a moment, if with your indulgence, Madam Chair, members of the board, to Dr. Megan Doyle, Assistant County Manager, who would like to talk to you a little bit about a Board of Commissioner directed summit that we are now prepared to announce and to give information on, which will occur on March 2nd. Dr. Doyle.
Good evening, Madam Chair, Mr. Vice Chair, Commissioners. It gives me great pleasure to communicate to you the work that really started with you in having a work and workforce summit. We will have this and host this summit in these chambers on March 2nd, 2016, starting at 8:30. What I'm most excited about is the speakers that we will have speaking to our community, our business leaders, our largest employers, hopefully, as well as our HR professionals who will be earning credit to attend these sessions. Specifically, we have an economist coming from the University of North Carolina at Wilmington who will speak about the statewide economy and its impacts locally in Onslow County and the southeast region of North Carolina. We will have the director of the Eastern North Carolina Workforce Development Board, Ms. Tammy Childers, as well as Mr. Carl Zerl, which is the director of the southeast region of North Carolina Works, which is our previously the Employment Security Commission, as well as we're very excited about this speaker. Dr. Ronald Lingle will be speaking to us about the workforce development programs at Coastal Carolina Community College. Obviously, he is a great partner of ours in county government, but he's also a great partner to our military community. Another partner who will be participating is Ms. Kimberly Williams. She is currently the Human Resources Director with the City of Jacksonville, but she is also working for the Governor as the Executive Director of NC for Me, which is an initiative by the Governor to ensure that veterans' issues are brought to the forefront and employment for veterans are brought to the forefront as well. And finally, we also have members of the Onslow County School System who will be participating and speaking to our participants, Dr. Leslie Eason, the Associate Superintendent of Curriculum and Instruction, as well as Mr. John Shannon, who is the Director of Career and Technical Education. We have a really great program established for that day, and we are really excited to invite our local stakeholders to be a part of finding out what's going on with work, job creation in Onslow County, as well as the workforce training programs and the economy around those programs in Onslow County.
How long do you anticipate? You said it starts at 8:30. Are we anticipating going through lunch, or what's your?
We're going to have a 3-day summit. No, I'm just joking. I've been told, I've been put on notice that we cannot go past lunchtime, and we will be done at 12:30 that day.
Okay. Well, I hope everyone marks that on their calendar. It sounds like there will be some good data provided to us, and
Madam Chair, just to be clear, that summit is open to the public. So
yes.
we invite the public to attend.
yes. And I'm assuming it will be televised for those that are unable to attend.
Yes, ma'am.
Thank you.
Thank you very much.
Thank you, Meg. You have any further, Mr. Manager?
No, Madam Chair, thank you.
Okay. Commissioner comments? Ms. Williams, would you like to begin?
Yes, thank you, Madam Chair. I've got something really on my heart that I want to share with the citizens this evening, and I've had several comments from different citizens in reference to the crosswalks here in Onslow County. And when the children are crossing the street, please be mindful as you're driving. Mainly, I got a number of calls in reference to Jacksonville High School, and sometimes, you know, people are still on the phones. We get distracted as we drive sometimes, and sometimes we're not paying attention to the speed limit when you're going into school crossing districts. And I'm just asking you to please be mindful. I have one of the parents that came to me, he's out there videotaping as the kids come across the street, and you'd be surprised sometimes how fast some of these cars are moving through these school crossing areas in town. So I would just ask the citizens, please watch as you drive through Onslow County and our school areas, and be mindful. And one other thing, I recently joined one of the fitness centers here in town, and it's really been interesting seeing how many people are out getting fit in Onslow County. And I tell you, just talking with different people, it's very rewarding to know that we are moving towards a healthy county, because as we're out there exercising and eating healthier, I know Miss Angela Lee would love to know those statistics as we become more of a healthy county here. So kudos to the citizens that are out there, and those of you that are preparing for that journey. And also, I would like to thank the staff, the finance department, Ms. Angela Lee, you and your efforts leading the Zika virus. It was very good hearing that information this evening, and thank you for being proactive in that effort. And also, Mr. Tony Paget, for the work that he's doing in vector control. Thank you so much, and just thank you to the great staff that we have here in Onslow County in all our departments. Thank you, Madam Chair.
Thank you, Ms. Williams. Mr. Bright?
Thank you, Madam Chair. Congratulations to the African American Small Business Association. I think that's quite an accomplishment for our Chamber of Commerce, and do a lot for the community and promote a lot of businesses and out front with a lot of organizations, and I'm just proud to be a part of that. Also, there was some mention about, I think, Jeff, about our Veterans Administration, and that was some good numbers. And I had the opportunity, because somebody had called me and asked me about what our Veterans Administration does, and I talked to Miss Amelia, and she really clued me in on that. And we don't provide any medical treatment, but we do, that organization does file applications, helps people file applications and get them to where they need to go, and pushes that organization. We're required to have that function, and the county spends, and we put in that budget with 6 employees, it's $382,000 a year, and the state's very generous. They give us $1,500 for that program. So that just goes to show you what we do as to promote and try to help our veterans get to the right place. Once they get there, that's a different story, but at least we got somebody that's really passionate about taking care of our veterans, and Lord knows we have a lot of veterans because of the military being here and people retiring here and people in different branches that need some help to get them in the right direction. And the USO was another thing. I wasn't able to make it, but the USO dedication at our airport was a good thing too. You won't know how valuable that is when you fly into London and there's somebody there waiting on you at the airport to help those young service members get to where they need to be, and help them with rides and give them direction, and they feel like they're home. So our airport is very fortunate to have that USO function in that. I just wish I could have been able to be there. Other than that, have a safe trip home, and thank you for coming tonight.
Thank you. Thank you, Mr. Bright. Debbie?
Yes, I got one thing I would like to mention, follow up on what county manager said about Mr. Morton, Mr. Cecil Morton. I knew Mr. Cecil Morton when he was a county commissioner, and you can call him Mr. Water, because Mr. Cecil Morton is the reason and the one that started county water. And if the citizens were to really listen to him and him looking in the future, at the time he was getting the water, I would say now the majority of Onslow County would have sewer, because he almost had that started in the southwest area, and people got told, misled what was going to happen and all, and so the grant that they were going to give, it got canceled. And Mr. Morton has contributed a lot to Onslow County. Onslow County, the people were in his heart when he was a county commissioner. He wasn't sitting there for his just self-service. He really served the people, and he served them well. And I have nothing else to say.
Thank you. Vice Chair?
Not much to add. Pretty much everything's been said. The only thing I'd like to add is the 2nd Marine Division parade that we went to was outstanding, and it was a privilege to be there and an honor for our service people, for us to look out and honor them for what they do for us and for this country. Everybody have a safe trip home. Thank you.
Thank you. Well, I don't have anything to say tonight, so I'll just ask if I can have a motion to adjourn.
So moved.
Second? All in favor?
Aye.
We're adjourned.